Do you have questions about exercise while you're trying to conceive? Then stay tuned because I'm going to answer the 3 most common questions about that. I'm Dr. Brenda Heinecke, and if you're new here, we talk about all things women's health, so make sure you subscribe. All right, the question that I hear the most is, can exercise cause fertility issues? And the answer is yes, it can contribute to issues trying to conceive. Let me explain. If your exercise intensity or duration is too intense, it might be impacting how your body is functioning with ovulation. It might be throwing off your hormones. So if you are noticing any irregularities in your period from taking on newer exercise, or if you've noticed that your intensity has increased and you've seen some changes, that can tip you off, but you might not even know. It might not even be apparent because you might not see any changes with your period, or nothing's different. But if you are struggling to conceive, then something to just kind of keep your eye on is how you're feeling after your workouts. Are you really tired? Is it taking a lot out of you? Exercise is great and movement is great. We just have to find the right balance between that intensity so that you can still be able to ovulate and have the best outcome. So try that. If you monitor your HRV, you can also use that. So that's heart rate variability. We utilize software here with our clients to see how they're recovering from their workouts because everyone's body is a little different. But if you notice that your body is in a stressed state for quite a while, longer than just 30 minutes after that workout, that might tip you off that your intensity is a little too much. You might also want to try to dial it back on HIIT workouts or boot camp classes and just stick with weightlifting or cardio, depending on what you're doing, because the HIIT workouts are going to be the most intense type of workout. So switching over, or even something a little lower impact like bar class or Pilates, is a great option. Question 2, can I do ab exercises if I have infertility issues? The answer is yeah, sure. There's no research that shows that doing core work or ab exercises negatively impacts your fertility. Again, you do want to just pay attention more so to the intensity, like I just talked about with those HIIT workouts or boot camp classes. But if you're just doing some core work or ab exercises as part of your workout, that's totally fine. One caveat is if you're undergoing IVF, you may want to curb all of that during that process, because they oftentimes will recommend very light, gentle exercise, sticking primarily with walking. And that's a lot of times so that you don't really get limitations with your connective tissue and the ligaments, or have any kind of torsion on the tube. So that's the caveat to that. But any other time, core exercise, totally fine. And the last question is, what is the best exercise during IVF? Again, you are a little more limited and you're probably stuck to just walking. Gentle movement is your friend when you're doing IVF, and that's totally okay. It's temporary, and don't feel bad if you're used to doing something so much more intense or a lot more different types of activities. It's perfectly okay, but you do want to just stick to very gentle movement, walking, stretching, and avoid all the other stuff, because like I just said, it may decrease your chance of success with IVF, and there are some research studies that show that. So we want to just be very gentle during that process and just allow our bodies to have the best blood flow and nourishment to that area and not have as much inflammation. So I hope this helps. If you have questions, feel free to comment. You can also grab our free guide all about fertility down below in the links. So see you soon.